It is the world's most widespread health crisis. Luckily, the solutions are within the reach. This is according to the co-founder of the Bill and Melinda Gates Foundation, Bill Gates.
And due to this, nutrition experts are now seeking urgent and coordinated efforts ahead of Nigeria's next budget cycle to increase domestic funding for nutrition access to multiple micronutrient supplements and the enforcement of the marketing code on breast milk substitutes.
These form the basis of discussion at a one-day engagement between civil society organizations, development partners, and the media.
The National Multi-Sectoral Plan of Action for Food and Nutrition was launched as a strategy to help tackle malnutrition in Nigeria through coordinated efforts across key sectors. Nigeria's Economic Council also endorsed the N774 program as a primary platform for combating malnutrition in the country and also agreed to prioritize nutrition interventions in the 2025 budget across federal, state, and local levels.
The years go back. Goes on. Next slide, please.
On the back of these strategies to improve the national nutrition outcomes by the government, these experts are also highlighting the need to strengthen the implementation of the National Multi-Sectoral Plan of Action for Food and focus on increased nutrition funding.
Not only budgeting for these items, but releases in the state most of the time is like you find out that yes, they are budgeting for nutrition activities, but there are no releases.
From the grassroots, the wards, the local governments up, we can we can indeed curb and put an end to malnutrition.
The World Health Organization's global target of exclusive breastfeeding stands at least 50% by 2025, but statistics show that Nigeria currently accounts for only about 29%. Despite this low rate, the full implementation of the breast milk substitute marketing code, which aims to protect breastfeeding substitutes by regulating marketing, is still hampered by weak compliance and enforcement mechanisms.
Nigeria now is working towards this national food system pathways to see how do we change our food systems to improve nutrition. Is it just to feed? No, we should feed and ensure that we get enough nutrition from the food we eat. And such strategies include recommendations that babies should be breastfed exclusively for 6 months. That's the beginning.
Without sustainable funding, the NMPFAN goals will remain out of reach, leaving millions of Nigerians, especially children, vulnerable to malnutrition and its devastating impacts.
And joining us live is the Communications Office and Civil Society Scaling Up Nutrition in Nigeria, Lillian Chinege Okafor.
These are the people who know the present movement in Rivers State is working. These are the people whose vote brought somebody to power. Let me tell you, those here are less than 1% of our people that are in the various local governments. And they are telling us they have not seen anybody. So what happened is that people went and paid things and they are trying to do a challenge to show that election is going on in undesignated places.
Age 6 to 23 months consume unhealthy foods. We have a serious problem at hand, and there is a lot that we can do as a country to address this challenge. The first thing that we need to do as a country is to prioritize nutrition across all levels of governance. CSON commends the National Council on Nutrition, that is domiciled in the Office of the Vice President. They have been doing a lot, with regards to ensuring that we work out strategies that will help us improve
Okay, I think that's...
well, it's a life situation. Sometimes you expect, but then looking at, the issue of malnutrition and what she was saying already, and do you really think that, because we were talking about stomach infrastructure, to Kemi earlier, yes, so with us lacking behind in that area, how do you think we can scale up in the issue of nutrition? Because so people would first eat, then before they start thinking about eating healthy, so to say.
I think it's actually major down on funding, funding from the federal government in terms of the nutrition funding in the budget,
especially for children.
Especially why? Because when you have that, it trickles down from when you have the budget. The states can also impact it, but by having to have those plans in place for children, like she mentioned, from the age of 6 to from the age of 6, those things are supposed to be in place. And when those things are not in place, that's where you have people, they can't probably assimilate well. You see children, I was coming this morning, driving down to the office, I saw some children, not well,
not looking,
well.
looking like what we used to see during pictures of the war.
So you have to probably look at how government can also take responsibility for this set of people. And also, don't forget, I think that to a large extent, I feel that, the issue of how people,
take care
of themselves, it's a bigger problem.
Okay, so but then when we look at it on that level, and then she's talking about children ages 6 to 8, if I'm not mistaken. But then you also know that there is another age group that is endangered, and that's the babies. People who are still of the breastfeeding age, and even mother is not feeding well. So if we say let's concentrate on the children,
I took
for 2 years,
3 years,
for 3 years, yes. That's why you turned out the way you are. I mean, malnutrition has nothing on you. We can clearly see that. I don't remember the number of years, but I'm sure. It couldn't have been 6, so maybe about 2 or 1.5. I'm not sure. Yeah, for me. So, but if the mother is not feeding well, how is she going to sustain a 2 years breastfeeding program, 6 months exclusive breastfeeding to ensure that the child is, well fed, and all that? I think that the awareness also needs to be done. When if she does not have the means, there's no other awareness going to give her. I understand the means. You understand? I understand where that means is supposed to come from, but at the same time, there needs to be a lot of awareness that needs to be created. Some persons even have the means, they don't have the awareness. That's another different conversation entirely. So there need to be that balancing between the two, the means and the awareness at the same time. So I think that for CSOs like them, scaling up, they need to go in terms of let the people know exactly how these things are not. You look at how Nigeria accounts for 29% of exclusive breastfeeding rate. And you think that how do we? Okay, if you have 29%, so what's happening in the society? Well, it means that a lot of people are not engaging in exclusive breastfeeding, and but then the issue also with data. Sometimes, basically, we gather up data with the number of people who come to the hospital, and then you. Are you going to be doing exclusive when you give birth? Yes, of course. I want to believe so. I don't know why you would say you want to believe so. It's not an impossible thing. Okay. I heard she's back now. So can you hear us?
I can. Okay. I can hear you.
Right. Okay, so I just want to put it towards you. What do you think that the government needs to do? Because there seems to be the issue of funding seems to be a very critical part of this discussion. And how do we address this? And in addition to that, when you look at our statistics, Lillian, sorry, before you go, when you look at our statistics, the fact that we have just 29%, exactly, engaging in exclusive breastfeeding. So that tells a lot about maybe a bit how backward we are in the general discussion of nutrition.
Yeah, thank you so very much. So, like I was saying earlier, we need to prioritize nutrition across all levels of governance to address the burden of malnutrition. There is a need to increase budgetary allocations to nutrition, in the 2024 budget and in subsequent budgets, that are to be preferred for the country. We're currently in the budget cycle, and the burden of the malnutrition challenge in the country, calls for increase in budgetary allocations for nutrition. The need for this increase in budgetary allocations for nutrition is very, very important because Nigeria remains, the second highest number, has the second highest number of children in the world, that are stunted. Our children continue to die, and suffer from preventable childhood killer diseases, of which 50%, are tied to incidences of malnutrition.
Wow. Well, all right. Thank you. But that's the much we can take from Lillian this week. And we go straight to entertainment after the break.